Hi everyone, good morning. Today I'm going to show you the procedure of cardiopulmonary resuscitation or CPR. Okay, this procedure will follow the guideline from the American Heart Association 2015. Before we start with the cardiopulmonary resuscitation or CPR procedure, I just want to highlight the step according to the American Heart Association 2015. So the guideline we follow is the DRCAB. So D is stand for the danger, R stand for the response, C stand for the circulation and also chest compression, A airway, and B is the breathing. Okay, now I show you the procedure of the CPR. So we start with the D, danger. So make sure the victim is free from any danger. So after danger, we proceed with the response. So we have to check for the response of the victim. Okay, hello, mister. Hello, mister, are you okay? If no response, we shout for help. Okay, somebody, please call ambulance. And then we proceed with the C. C, we have to check for the circulation of the victim. Okay, how to check the circulation? So you have to find the thyroid cartilage at the patient neck. Okay, feel the thyroid cartilage and you pull your finger 2 cm aside. And then you feel for the carotid artery for about 10 seconds. If no pulse present, the patient is considered unconscious. So now we have to proceed with the C again. C for the chest compression. Okay, now I show you the location for the chest compression. Okay, for the chest compression, you have to put your hand at the middle of the chest between nipple line. So first, you have to find the xiphoid process. Okay, this is the xiphoid process of the victim. So 2 fingers above the xiphoid process and the between nipple line. Yes, this is the location for your chest compression. And then you have to put the heel of the hand on the middle of the chest and another hand on top of it, like this, and then you interlock your finger. Okay, this is the position for the chest compression. Okay, so you have to perform the chest compression about 30 times. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. So after 30 times of chest compression, you proceed with the A. A is a airway. Okay, now we proceed with A. A is a airway. So in order to check for the victim airway, we have to put patient in the health teaching technique position. Okay, one hand put on the head and another hand on the chin. And then you have to push a little bit at the back, like this. This finger, open the mouth. And then you check in the victim mouth. If there is a foreign matter in the mouth, so you have to remove it. Okay, after this, we have to check for the patient patency of the airway. Okay, to check for the airway patency, you have to remain patient in the health teaching technique position. So bring your ear close to the victim mouth, like this. Okay, so your ear hear for any breath sound, your cheek feel for any breath sensation, and your eye look for the chest rising. Okay, if no airway patency and no evidence of breathing, so we have to perform two rescue breathing that we call mouth-to-mouth resuscitation. So you have to deliver the effective breathing through your mouth. Okay, remain patient in the health teaching technique position. Using these 2 fingers, press the nostril of the victim, and this finger open the mouth. So the rescuer, you have to take a deep breathing, and then bring your mouth close to the victim mouth and seal it very tightly in order to prevent from any air leaking. And then you have to deliver 2 rescue breathing. After you deliver 2 rescue breathing, there is 2 effective breathing resuscitation. So you have to continue to perform chest compression. So 30 chest compression must followed by 2 rescue breathing about 5 times. So 5 times chest compression and 5 times 2 rescue breathing equivalent to 1 cycle. So complete 1 cycle, you have to check again the carotid artery. If the pulse is present, so you have to put patient in the recovery position and wait for the ambulance to take over. So during the recovery position, just monitor for the patient breathing and also face expression. And wait for the medical personnel to take over the procedure. Thank you. In performing CPR in the ward, I just want to highlight about delivering in breathing for the patient. So the main difference between CPR in the ward and CPR in the out setting is the delivering of the breathing. So for the CPR in the ward, normally we have to intubate patient in order to maintain the oxygenation to the patient. Whereas for the CPR in the outside setting, we have to perform the mouth-to-mouth resuscitation. Now I show you how to perform CPR in the ward. Good morning, Mr. Ali. Mr. Ali? Hello, Mr. Ali, are you okay? Mr. Ali, are you okay? Please, somebody call for help, please. Call for doctor now.
Patient collapse. Okay, I will go for doctor. Please skip. And the back. You bring me the airway, please. Airway. Mask. Okay, check for the rhythm. How about the rhythm? No rhythm. Assistant. Okay, Sanadila, please start chest compression now. One, two, three, four, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 7, 8, 9, 30. 17, 18, 19, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 7, 8, 9, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 7, 8, 9, 30.
Okay, during CPR in the ward, so we have to deliver the breathing to the patient through the resuscitation bag. So now I show you how to use the resuscitation bag. So this one we call oxygen tubing, face mask, airway, and also resuscitation bag. This one we call reservoir. Okay, first, you have to connect the oxygen tubing to the oxygen. And open about 15 liters of the oxygen. So you connect the tubing at here. Okay, you should close this one to allow the reservoir bag to inflate, and then connect with the face mask. Okay, now I show you how to insert airway. Okay, this one we call airway. So this is the measurement for the airway for this patient. Okay, you just put like this, insert to the patient mouth, and then turn, and you put like this, and provide patient in the health teaching technique. Then you put the face mask on patient face. Make sure the face mask cover nose and mouth and remain in the health teaching technique position. Another hand, so ready to press the bag. Okay, during CPR in the ward, intubation is a must for the patient in order to provide a better oxygenation to the patient. Okay, now I show you the equipment for the intubation. So here we have a laryngoscope, we have the medial forceps, scissors, stylet, Yonker suction, and this one we call ETT tube. It comes with the varieties of the sizes. We also have a gel to lubricate the ETT tube, torchlight to visualize the patient mouth, and medication. So we have atropine, adrenaline, midazolam, and also muscle relaxation medication. This one, all the syringes and needles. You also have to prepare for the sterile glove because this is a sterile procedure. And at this part, all the oxygen apparatus, and we also have a suction machine to suck all the excess secretion from the patient mouth. Okay, we also have a string and also tape. Okay, the function of string and tape to anchor the ATT after the intubation. So the using of the tape or string is depend on the hospital protocol. And the last but not least, we also have to prepare for the disposable glove and also face mask in order to prevent from any infection to the healthcare provider and also to the patients. Okay, so the disposable glove and also face mask. With that, I end my presentation.